Hello, I'm Dr. Petzel. Today I want to talk to you guys a little bit about stress reactions or stress fractures in the runners. We've been dealing with that a lot lately and wanted to kind of go through what kind of research there is out there and also what we can do to make sure that this doesn't become problematic. One of the biggest things is, they found that stress fractures happen when you're either increasing your speed throughout your workout, so you're all of a sudden starting to do maybe more speed training, and also the other thing is if you're increasing mileage rapidly. So those are, first of all, the first variables that we found that there's some sort of correlation and definitely a causation when you're dealing with stress fractures. The second thing, well, this is some of the stuff that they're really trying to see what is causing stress fractures and what is causing these stress reactions in the shin. So one of the things that they've looked at is actually the calf size. So believe it or not, the vibrations from the ground up when you're running create a stress on that bone. So if that bone making material can't keep up with the bone breaking material, then sometimes that stress reaction or stress fracture can happen. And a lot of times it's through that vibrational force that is, that constant pounding on the pavement. So one of the things that you can obviously do is, trying to work on calf size and making sure that you have enough muscle to absorb that stress. Now you can also then take that and look at proper footwear. So a brand of shoes called Hoka's, they're a little bit more cushioning. So rather than being the minimalist and very little cushioning, we have the Hoka's, which have taken it and actually the extreme cushioning and absorption, so that way you can prevent stress-related injuries to the leg. You also have certain other types of inserts that you can use to try and minimize that type of effect. Orthotics will kind of help minimize a lot of that impact as well. Outside of that, there's another study that besides the calf size, the only other thing that they really found is that these stress fractures or shin splint type of reactions occur when you have too much motion in the hip. So if you have internal and external rotation of the hip that is exceeding normal limits, that a lot of times that is the only other kind of correlation that they have found with stress fractures and why people get them. So the biggest thing is really kind of making sure that you work on your foot, just toe raises, both bent leg and straight leg. That can increase the size of the calf. So doing that as a way to kind of hinder that, making sure that you're having a good cushion shoe like a Hoka or something if you're really prone to it. By having leaner size calves, then I would say maybe run in a Hoka. And then the other aspect of it is making sure that you do strengthening of the hip, so that way we can kind of keep that stability in that hip joint, minimizing a lot of the impact on the leg. If you want more information, you can read through our article that we just released on stress fractures and stress-related injuries. You can also email me at drpetzel@adchealth.com or info@adchealth.com, and we can answer any questions related to this and some of the treatment parameters. In our office, we use a lot of the Alter G training, which is going to take the impact off and reduce a person's body weight by up to 80%. We also have Class 4 laser therapy, which we've seen right here, that can kind of work on cellular health and metabolism, getting that cell to speed up the healing process. We also use the power plate, so we use the power plate to try and increase bone density, but also just really kind of loosen up those muscles and the tissues that have that chronic tension due to the repetitive nature of running. Like I said, if you have any questions, please email us. Have a good day.